In this module, we will be going over the community curriculum. As with food service, you will find two areas of the student handbook that has a list of activities that will help to meet the competencies outlined in the community curriculum. If you refer to page 25, this will be that bulleted list that is not tied directly to a competency, but rather it is left for you and your preceptor to decide what competency that activity best meets. To flip to Appendix B, that is where we will find our community rotation, competencies, and evaluations. So you'll notice that the curriculum is set up the same way as food service, with the competencies on the left-hand side. Those bolded competencies, again, are the ones that will appear on your evaluation. In the middle column, we have possible, not required, experiences that will help meet those competencies. And then on the right-hand side, you've got those evaluation strategies. With food service, you will notice that doing different activities such as developing a lesson, teaching a group class, asking them to complete an evaluation, these will meet many of the different competencies, not just one. But with that being said, let's dive right into this list. So for Domain 1, CRDN 1.1 appears again, selecting indicators of program quality or customer service and measure achievement of objectives. So you may review statistical literature of an agency, examine statistical data collected by the facility, and determine statistical methods that are utilized. So for example, if you are in a community program where they have a diabetes class, you may wish to analyze A1C levels of patients before participating in the class and then looking at their A1C levels a couple months after completing the curriculum. CRDNs 1.2 and 1.3 don't appear on the evaluation, and we've talked about them already. They're applying evidence-based guidelines, systematic reviews, and scientific literature. And then 1.3 is justifying programs, products, services, and care using appropriate evidence and data. So for the evidence-based guidelines, you might refer to the Academy's Evidence Analysis Library in developing one of your group classes, or incorporating relevant community nutrition research into your practice and your counseling. For 1.3, you might interview the manager of the department regarding the impact of other professions in nutrition services, and also provide justification for educational programs and materials. CRDN 1.4 is to evaluate emerging research for application in nutrition and dietetics practice. So you might evaluate the effectiveness of printed materials that they use in their counseling, or incorporate any relevant community nutrition research into practice, again, just using that evidence-based practice in your counseling and education. CRDN 1.5 is to conduct projects using appropriate research methods, ethical procedures, and data analysis. So this could be attained from getting feedback from different surveys at the end of the class that you taught, or planning and implementing your outcomes study at different rotation sites. CRDN 1.6 appears on this curriculum as well as food service. It is incorporating critical thinking skills into your overall practice. So again, as with food service, you will have ample opportunities to use critical thinking probably every single day in your rotation. But just a couple of examples is locating information on your own without asking questions, really trying to get answers for yourself before asking your preceptors, and then envisioning the end results when working on a project and discussing that plan with your preceptor to ensure that you are successful. For Domain 2, CRDN 2.1 is to practice in compliance with current federal regulations and state statutes and rules within the scope of nutrition and dietetics and within the code of ethics of our profession. So again, we will perform all these duties and tasks in accordance with our standards and our code of ethics. You'll abide by all of the organization's policies and procedures, maybe attending orientation, and then complying with HIPAA at the site or the class that you're working with. 2.2 is to demonstrate professional writing skills in preparing professional communications. So, for example, if you have the opportunity to create an educational handout that you can use in a class that you are teaching, that will demonstrate those professional writing attributes. CRDN 2.3 demonstrating active participation, teamwork, and contributions in a group setting. So again, volunteering yourself to go to a health fair, to teach a group class, really just taking that active teamwork and participation. CRDN 2.6 is to refer clients and patients to other professionals and services when needs are beyond our scope of practice. So for example, you would want to use their referral system according to their specific policies and procedures, but perhaps you're counseling a patient who has some swallowing trouble and you want to make a referral to a speech pathologist. That would meet this competency. So always be on the lookout for those types of referral services that you could suggest. CRDN 2.7 is to apply leadership skills to achieve desired outcomes. Again, just jumping at any chance you can to chip in, being that active team member, and really advocating for your own experience at that supervised practice site. CRDN 2.8 is demonstrating negotiation skills. This could be when you're counseling a patient and you are going back and forth about how they could better their diet or what changes they're willing to make. And then fielding questions at the end of our presentation could also be a way of negotiating with your audience. CRDN 2.9 is to participate in professional and community organizations. So if you have the opportunity to attend maybe an ABA meeting or any other type of wellness coalition meeting with your community preceptors. CRDN 2.10 is to demonstrate professional attributes in all areas of practice. Again, being on time, professional dress, responding appropriately to emails, all will meet that competency. CRDN 2.11, showing cultural competence and sensitivity in interactions with clients, colleagues, and staff. Just being culturally aware, especially when counseling a client of a different ethnicity, maybe discussing with your preceptor the adjustments that they make for different counseling sessions. 2.12 is performing self-assessment and developing goals for self-improvement. Again, you will meet this competency during your midterm self-evaluation, but also just doing self-audits of your documentation throughout the rotation process will also be helpful. CRDN 3.3 is demonstrating effective communication skills for clinical and customer service in a variety of formats and settings. So you may disseminate a nutrition-related issue through the contribution of professional newsletter, some type of press release, developing a poster or a video, doing public forums at a health fair, handing out education forms, etc. CRDN 3.4 is to design, implement, and evaluate presentations to a target audience. So again, planning for a group education or doing a group support can help with those activities. CRDN 3.5 is to develop nutrition education materials that are culturally and age appropriate and designed for the literacy age level of your target audience. So again, if you're developing those education materials, make sure that you ensure that they are culturally and age appropriate, and also knowing the demographic of your target audience and what their reading level is to make sure that the literacy level is appropriate. CRDN 3.6 is to use effective education and counseling skills to facilitate behavior change. You can easily meet that competency through either one-on-one or group counseling. CRDN 3.7 is to develop and deliver products, programs, or services that promote consumer health, wellness, and lifestyle management. So you could review materials related to supplemental feeding programs, or plan, present, and evaluate classes for special population groups. CRDN 3.8 is to deliver respectful, science-based answers to client questions concerning emerging trends. You can refer to the Academy's Evidence Analysis Library, referring to your own evidence-based research, and then delivering that respectful yet science-based answer to either your client or in your group educations. That concludes Appendix B, and will also conclude our module on the community curriculum. At this point, I would strongly encourage you to take a short break, get up, walk away from your computer. The next module that we will be going through is clinical competence.